All right, let's begin with the big story this evening is India's newest version of its vaccine policy. So some tweaks along the way, and that announcement was made by Prime Minister Modi this evening. The discussion since then has been about what has prompted the change. Was it a realization because of opposition barbs and Supreme Court cracking the whip that the central government has decided to revert to a policy where they produce the lion's share, or they procure the lion's share of vaccines produced? Is it because, as Prime Minister Modi said in his speech, states who were flip-flopping on their stance, that the policy had to be changed once again? Whatever it may be, the fact is that the new policy will be welcomed and has been welcomed by all around, including opposition state chief ministers. So this is what happens now. The central government goes back to procuring vaccines for COVID-19 from manufacturers. Whatever's made in India, 75% of that will be sold to the central government, 25% to private players. They will give the vaccines, the central government will give the vaccines for free to states. And from the 21st of June, all Indians above the age of 18 will be eligible for free vaccines at government centers. Private centers can continue to procure and sell vaccinations to those who prefer going to a private center or private hospital to get themselves vaccinated. But there is a cap on how much they can charge in terms of service charge at 150 rupees. That's the long and short of the new policy. Let's listen in to Prime Minister Modi explaining why the decision was taken.
साथियों, आज ये निर्णय लिया गया है कि राज्यों के पास वैक्सीनेशन से जुड़ा जो 25% काम था, उसकी जिम्मेदारी भी भारत सरकार उठाएगी। ये व्यवस्था आने वाले 2 सप्ताह में लागू की जाएगी। इन 2 सप्ताह में केंद्र और राज्य सरकारें मिलकर नई गाइडलाइंस के अनुसार आवश्यक तैयारी कर लेगी। संयोग है कि 2 सप्ताह बाद 21 जून को ही अंतर्राष्ट्रीय योग दिवस भी है। 21 जून सोमवार से देश के हर राज्य में 18 वर्ष से ऊपर की उम्र के सभी नागरिकों के लिए भारत सरकार राज्यों को मुफ्त वैक्सीन मुहैया कराएगी। वैक्सीन निर्माताओं से कुल वैक्सीन उत्पादन का 75% हिस्सा भारत सरकार खुद ही खरीदकर राज्य सरकारों को मुफ्त देगी। यानी देश की किसी भी राज्य सरकार को वैक्सीन पर कुछ भी खर्च नहीं करना होगा।
Kiran Mazumdar Shaw, Executive Chairperson, Biocon, on the show with us this evening. Professor K. Srinath Reddy, President at the Public Health Foundation of India, joining us on the discussion. Dr. Ashutosh Raghuvanshi, Chief Executive Officer and Managing Director at Fortis Healthcare, also speaking with us today, as is K. Sujatha Rao, former Health Secretary of the Government of India. Welcome to all of you, and thank you for joining the India development debate on what is truly a big day for India's vaccine policy. Ms. Shaw, how do you look at it? Is it a reversal and reverting to a system that works better? The calls for a central procurement of vaccinations have been loud and constant. Will this ensure that we get better prices for vaccine, and will it ensure a faster rollout, which is the real aim at the end of the day?
So, Tamanna, I really think this is an important course correction. In fact, I myself have been asking for a two-priced, vaccine policy where the government pricing should be one and there can be a private price point on the other hand. I was absolutely not in favor of having 3 price points where the state government procures at one price, the central procurement happens at another price, and the private sector procures at a third price. So I think this is very welcome course correction. And I also believe that, yes, I think the center ought to basically, use this centralized procurement to negotiate for a better price. And I'm glad that is actually going to be rolled out to various state governments at for free vaccination of people. And I'm also happy that they've also come out with a price cap on the service fee that hospitals can charge. And of course, the people who want to go to a private hospital obviously have to be prepared to pay a higher price, and obviously they will be priced different prices based on what vaccine they are going to be vaccinated with. So in the private sector, it is going to be a very different scenario. But at least in the government sector, people will get free vaccination. And the only point that I'd like to make is I hope that there is going to be a good transparency in terms of vaccine allocation to states. And more importantly, I think state governments need to be given intimation about the allocation so that they can be prepared for the vaccination rollout. Because right now, the kind of vaccine availability is sort of almost like sporadic, and state governments are not able to forecast or plan for vaccine deployment. So I think a vaccine allocation and the time table of vaccine allocation to various state governments ought to be very, very transparent and clear for better vaccine planning.
Dr. Raghuvanshi, how do you feel about the cap of 150 rupee on service charge for the private sector? And do you think this means cost of procurement plus 150, or would things like storage charges, etc., also be added on by private sector players? Do you think it disincentivizes you to roll out the vaccine program with this cap?
As an industry, I think the opinion may differ from different providers, but we have always stated that vaccination is not a commercial proposition for us. It is more of a community engagement tool for us. So having said that, 150 rupees does cover the on-site vaccination camps. There would be no additional charges as far as storage or any other logistic needs are concerned. That is very clear that 150 is the limit to which surcharge can be charged. However, if off-site camps have to be done, like for corporates, etc., their 150 would become rather difficult because there's a GST component if the companies are paying directly. And at the same time, there is also certain additional logistic requirements when we are doing off-site camps. So that will be slightly challenging. But overall, I think it is a welcome step.
Professor Reddy, do you think this dual system of government vaccines for free and private vaccines which are sold works? There are some now who believe that all vaccines should be provided free. And this new system, do you think it will lead to better efficiencies and a faster rollout?
Well, I do believe that all vaccines should be provided free. And I believe this course correction has really brought us back onto a path where we can ensure both efficiency and equity across the country. Now, the private sector participation, even in the earlier instance, has been to partner the government in providing vaccination in their facilities, and in a mixed health system, all players should step up. The question there is whether the pricing of what they administer as a vaccine, in addition to the vaccine itself, which is provided by the government, as a service charge, what do they actually charge the patient? And that is where I believe it's been capped now. However, ensuring that all healthcare providers, particularly the public sector, and wherever available and willing, the private sector partnering the public sector would be the best way of ensuring speedy vaccination across the country. And I believe it's been a welcome return to an earlier system which was functioning fairly efficiently. But the states which were put at considerable disadvantage by the change that had happened a few weeks ago now can breathe more easily because the center has now again resumed the stewardship. As much of the country went into a lockdown, the central stewardship also went into a lockdown. I'm very glad it's unlocked now. And we believe that we ought to be able to have a much better vaccination program now administered without inconveniencing the people and ensuring that all players, public and private, can join hands to deliver the program with greatest amount of speed and efficiency.
Sujatha Rao, do you think this is good enough now to revert to 75% central government procurement? Do we need to get some clarity at what price the central government will procure? Because you would recall there was a three-tiered price structure earlier, one for central government at 150, another rate for state government, and a third rate for private players, depending on which vaccine. Do you think that now we need to have more clarity on what these prices are and this necessity for the private players and the private sector to continue to procure? How do you see that?
Tamanna, to begin with, we have wasted a lot of time with that earlier policy of three-tier pricing and states buy your own, because every state spent a lot of time instead of controlling the epidemic. They were wasting time drawing up tender notices, issuing it, and all that, which came a cropper. So it was not a sustainable policy at all. Now, coming to the new one, of course, it's good that they have said that they will procure 75%. As we all know, that immunization policy depends and is based on the fact that on the principle that the central government procures the vaccines and gives it to the states as a shared responsibility as required under the concurrent list, where infectious disease control is both the responsibility of the state and the center. So the center is doing no favor to anyone in discharging its duty of making vaccines available, because that's the only way we can save ourselves from any more devastating impacts of the COVID. Now, the third point I want to make here is when the PM says 75% will procure 25% private sector, how do you draw the line about the 76th person who lands up at a government hospital and says, I want a free vaccine? Do you say, no, my 75% is over, now you go to the private sector? So, it's not a question of percentage. It is a question of drawing up how many people are there who want to come who are eligible for now the vaccination, and government enters and procures all that is required for them. Not say 25%, you can't put a percentage point on it. And as for, there's nothing new in this policy. Even as I speak today, all childhood vaccines you can get in private sector. You can go and get your polio vaccines, you can get your hepatitis B, you can get your flu shots, you can get all these vaccines which are provided under the government program in the private sector also at a price. So this is only continuing with an existing policy that we've been following for the last 4 decades. Finally, the pricing, earlier they had said that the companies will state the price, which was absolutely wrong. Now I hope that with a bigger market, government should be able to either through a tender, which is the way we do, ensure a baseline of the price is fixed and we buy, and the private sector will negotiate on their own. If, Dr. Raghuvanshi is a better negotiator, he can probably get Covaxin and convince them that he should be given the vaccine at 200 rupees. So why should any floor price be fixed beforehand for private sector? The point that they put 150 is a very good move, because as you might have heard, like all of us know, vaccines were being given at 2,200 rupees per dose. That was not a sustainable policy mix at all. And so, I think there'll have to be much greater transparency, much more micro planning, much more of doing a lot of the work that we could have done by now. They'll have to work very fast to make this policy a success.
Sure, but does it solve the problem of a shortage of vaccines? Ms. Shaw, the shortage as well as the logistical speed. I remember the last time we spoke, you talked about how we have to figure out how to get vaccines from the factory into people's arms in the shortest possible time. Do you think this new system helps? Because at the end of the day, center will procure, they will give to states, but it is states who have to distribute and have to figure out whether they're going door to door, how are they getting people to get vaccinated?
I don't think at all that's a worry at all, Tamanna, because they've been doing vaccination for children for the last 20 years. That ability to do the logistical planning, ability to reach it out to the last person, identifying the vaccinators, identifying the vaccination points, and if permitted, and which the flexibility is given, they'll identify the private sector people also who want to participate and partner with the government to do the vaccination. I'm not worried about that. But will this policy address the supply side? No, it won't. Supply side is still driven by the supply constraints.
Yeah.
Their raw material from US, their existing capacity to manufacture, and how much they can ramp up. So that all takes time. And but the point is, you at least don't have 35 people running after these two companies, and which ended up with your poor Mr. Adar Poonawalla taking refuge in London. I mean, can you imagine every day Chief Minister rings him up and says, give me the vaccine? How can that work? So, at least to that extent, there is now much more streamlining.
So
one tender,
that
one
question
order.
was for Ms. Shaw.
Oh, sorry.
No problem.
No, point taken. That question was
Sujatha,
actually for Ms. Shaw. But good to have your perspective. Good to have your perspective as well. Yes, Ms. Shaw, how do you look at it? I was quoting what you had told me earlier. We need to get the jabs from the plant to people's arms as soon as possible. Do you also
Correct.
agree with what Ms. Sujatha Rao is saying, that we have the system to do that?
So let me put it this way, Tamanna. First and foremost, we are in a stage of vaccine inadequacy. And we must understand that by what the Prime Minister has announced today doesn't address vaccine inadequacy, because that is going to be addressed by, as Sujatha very rightly said, ramping up production and making sure that we procure more vaccines from outside, and if other vaccines get approved, then that also adds to the vaccine capacity, etc., etc. So that is a very different challenge that we have, which is really going from vaccine inadequacy to vaccine adequacy, which I hope will happen by the end of this year. Okay. Now you come to the next, basically shrink the logistics timeline. I think it should, because like Sujatha really very rightly said, when you have multiple people trying to procure the vaccine and deploy it, there's a lot of confusion. Let me tell you, today the vaccine manufacturers themselves were being approached by various state governments, all fighting for a very small quantity of vaccines that was hardly available. And the center was procuring 50%, which was fine, but the remaining quantity, which was being fought over by all the state governments, became a mess. So I think that having a central procurement process will certainly provide better logistics streamlining. And I would only go back to what I said. Now that the center is going in for central procurement, I hope that they do better allocation planning. I hope they give adequate time to the state governments to give them a kind of a schedule of shipments, which says, okay, in week 1, week 2, week 3, week 4, Karnataka, you're going to get so many vaccines. In week 1, week 2, week 3, week 4, Madhya Pradesh, you're going to get so many vaccines, and so on and so forth. So that the government, the state governments can basically focus on planning and deployment, which is what Sujatha was referring to. Because otherwise, right now, they were all busy focusing on multiple things which they shouldn't have focused on. And they were actually not even getting the kind of vaccines they were hoping to get. And they were only, focusing on bidding, getting tender documents out, etc. So I think that this should help to shrink that logistics timeline. And hopefully my target of saying, can we get product from the shipment from the warehouse to the people's arm is 72 hours. It can be made into an objective. Because if you know when you're going to get the vaccine from the supplier, obviously you can plan to make sure it gets deployed to all your vaccination centers and it can get into people's arms very soon. So I think that's the kind of, time and motion studies that you have to do. That's the kind of logistics planning you have to do. And that's why I go back to the point that it is very important that the central government, because it's doing the central procurement, it also shares the schedule of supplies with state governments in a very, very transparent way.
My question is that do we need to continue with this bifurcation of central government procuring vaccines, giving it to states, states will deploy it through, government centers and hospitals, while the private sector buys them at a different rate and sells them? The reason I ask this, and let me come to Professor Reddy on this question, is that in India, the private sector has a larger reach one way or the other to most people. People are more dependent on the private sector than government sector. And I'm not just talking about large hospital chains. I'm talking at the smallest clinic level. Is it now really crucial to involve this segment as well? The jabs should be available at the local GP right now to get everyone vaccinated as soon as possible?
Well, I think the presence of the organized private sector is not that impressive or extensive in smaller towns and villages. You do have the individual GP and the unorganized private sector, even the unqualified private practitioners. But I do not think they can all be entrusted with the job of vaccination, particularly because there are certain requirements to be fulfilled in terms of how people are registered and how people are vaccinated. Certainly, as many people in the private sector can be co-opted into the government process of administration, which was happening even for the adult vaccination above 45 years. But that is a process that requires the public sector to actually take the lead and coordinate along with the private sector as per need and availability. I do not think we need to have a dichotomous relationship, but we do need to have a coordinated, cooperative approach in which we use all the resources that are available to society in the best possible manner. But ultimately, the responsibility will be of the state governments concerned. For example, depending upon the amount of vaccines that are available, which age groups do they prioritize? Which are the kind of groups that they will ensure will get vaccinated first with 2 doses? So those are all the kind of decisions that the state governments must make. And in that process, if they can bring in the private sector to cooperate and extend support as much as possible, good. But I do not think we can still have a fragmented system in which everybody makes a very different decision. And I don't think every single GP in a village or a small town clinic can actually be entrusted in this responsibility without adequate coordination and supervision.
Dr. Raghuvanshi, do you think there is a case for giving vaccines free to the private sector as well and let them inoculate? Let them inoculate with a 150 rupee charge or not that at all, and not even take that if they are so committed to doing it or seeing it as a community outreach, just so that you widen the spread?
No, absolutely. I think that would be a good idea. But I agree with Professor Reddy that, that public sector has to take the lead in this, and multiplicity and, kind of very dichotomous kind of provisions is not going to help in speeding up this process. But yes, if private hospitals were offered vaccination for free and it could be just on the service charge, that's exactly what happened during the first wave. At that time, the vaccination was being provided by the government to private hospitals, and we were charging only the fee for administering it. The rest of the procurement cost was going back to the government, and that was the process. So I think it is what is more important in the current scenario is the availability of vaccine. And I think that does not get addressed as far as this policy is concerned. The supply chain has to strengthen a little further. Maybe more vaccines have to be approved. Maybe some imports have to be enhanced. And those are the measures, I think, which are very, very important, because private sector can step up even further and maybe double or triple to the number of vaccines they are delivering today. And that added with the public sector can help in a big way. But the problem is there is no clear visibility in the supply of vaccines at the moment.
Ms. Shaw, do you think that could change with the central government turning into the major procurement agency? If there are negotiations with Pfizer, Moderna, etc., the situation changes now, doesn't it? With the central government coming in with a heft of a large number of doses to be purchased, or will we still have to wait? Because there's a long waiting list as far as global vaccine makers are concerned, and we're nowhere near the top of that list.
Well, let's face it, Tamanna, right now the whole world is in a state of vaccine inadequacy. So I think trying to kind of depend on imports to fill that gap is not realistic. Right now, whether you go for Moderna, Pfizer or Johnson & Johnson, they simply don't have the kind of volumes we need to really address our needs. So right now we have to really depend a lot on our own indigenous vaccine makers and see if we can ramp up that capacity, which is what is being done right now. Because Moderna, as you rightly said, the overseas vaccine makers have actually committed their capacities to COVAX and to other countries who have placed orders. So if India wants to get in at this late stage, I doubt you will get the kind of quantity that you're looking for. You will get some 100 million doses, at best for this year. Only from next year that you will start getting larger quantities from all these companies. So right now, I would really hedge my bets on indigenous manufacturers and some of the new vaccines that could be approved, such as Novavax, such as maybe, the biological E vaccine, maybe the nasal vaccine being developed by Bharat Biotech. But that also will happen towards the end of the year. So I think we should be a little realistic and not and manage expectations. Because if we think we are going to get 2.2 billion doses by the end of this year, I think that's aspirational. And we will be disappointed because we may not be able to get those kind of vaccines, the doses that I'm talking about. I think more realistically, we should pitch for
that is a claim made by two union ministers and the representatives of the health ministry that we will vaccinate all adults by the end of the year. I think that is a bit of an aspirational target. It is what is being claimed.
Tamanna, can I just butt in there? See, this is an aspirational target. Let's face it. I think if you say that you will get one jab in the adult population in India, that is quite, doable. But to say you will completely vaccinate everybody by the end of the year, I think is aspirational and not realistic. That is my view. I don't know what Sujatha and Srinath and Ashutosh Raghuvanshi say. But I personally believe we should be more realistic and practical and say that we'll at least try and get one jab in everyone's arm, which is doable by the end of the year.
Ms. Rao, your take on that, because at the end of the day, whatever may have been the reason for this reversal in policy, whether it's the Supreme Court observations or the opposition or the central government listening to state governments who did their own flip-flop, what matters at the end of the day is that we reach the vaccination goal. Do you think universal vaccination by the end of the year is doable? The target has been set at 1 crore a day of jabs if we want to get there. Is it feasible at all?
See, I do believe that India has the capability and capacity to do 1 crore jabs a day. I do believe it, and I can bet on that. But having said that, that will, of course, require a huge amount of micro-planning, logistic planning, and so on, which I think we do have the capacity to do so, provided that the Ministry of Health and the states are allowed to work in freedom, unfettered, and uninterfered with, number one. Number two, the problem here is not the capacity to deliver the vaccine as it is on the supply side. I agree with Kiran that I don't believe that 2 billion doses will be available by end of December. That's an aspiration. And I'm not so sure that we will be able to get the required quantities to sustain this 1 crore jabs a day. So that is the second point. The third is the biggest barrier could be for our performance is the vaccine hesitancy in rural areas. That is emerging to be a big issue, particularly in Bihar and UP. So that's where I think if they have launch an excellent communication campaign and give them that source of confidence that this will not harm them, and even if they have some adverse effect, the system will be able to take care of them, then there will be able to be a good pickup and momentum can be generated. So there are a lot of ifs and buts, but if you just ask, can you do it? Yes, we can do it. Give me the vaccine and I will do it.
Okay, Professor Reddy, another important question, and not entirely to do with the announcements today, but related. You also know that we are unlocking today in some parts of the country, namely in Maharashtra with a 5-level unlock plan. In Delhi, there is an extent of unlocking happening, and we want to pick up the vaccine drive as well. How do we ensure we don't make the same mistakes we made after the first wave when the unlocking took place and people really went all out? There was a complete disregard for social distancing, for COVID appropriate behavior, and we found ourselves in the middle of the second wave as a result. What can we do to ensure we don't make the same mistake?
Well, I think the environment is different after the first wave and after the second wave, which is still going on, by the way. The difference is that after the first wave, there was a false sense that we had actually overcome the problem on a permanent basis. All kinds of theories about herd immunity having been attained were being floated. There was a sense of urgency from the ordinary person to the leadership of the central and the state governments and the industry to get back to normal life as fast as we can. Now, the second wave has taught us a very sobering lesson that we can't take this virus for granted. And if we do so, that is at our peril. At the individual level, people have suffered tragedies in their families or among their dear friends or colleague co-workers. So everybody has experienced how devastating this second wave was. And even in terms of the governments, they've recognized that economy has come to a standstill. They've been challenged in terms of their provision of health services. I believe that sobriety that has been brought in by the devastating experience of the second wave will teach people to be much more careful. That is why we are seeing that even the government of Delhi, which was in a great hurry to unlock in the previous year, is now doing it in steps. And of course, Maharashtra has gone in for a fairly cogent 5-level exercise. So I believe we ought to be able to carry this message with greater conviction this time around, but certainly it requires a lot of political will as well to ensure that we are not going to have any super spreader events, even as people will have to be more disciplined in their COVID appropriate behavior.
You know, the COVID appropriate behavior is now a part of life. We'll take a very short break. I want to thank everyone for joining us in the first discussion this evening. Dr. Ashutosh Raghuvanshi will stay on with us, and we'll be joined by Vaibhav Khandelwal, co-founder and CTO of Shadowfax, for the next leg of discussion, where we're focusing on the corporate vaccination rollout, how an army of people who are part of, I would say, the formal employed sector are being vaccinated as we speak, in the hope that them being inoculated will help revive the economy. I'm coming back with that discussion after a very short break. Don't go away.